Hello, my name is Joni Warner, and today I will be talking to you about the human papillomavirus, or better known as HPV. We had never really heard of the virus until recent years. I don't even think most people realize that HPV is actually a sexually transmitted disease. Today I will be explaining to you what the cause and effects of HPV virus are and how we can limit the passing of the virus. I will be giving you information that has came from qualified doctors on the subject. I will be discussing what the virus is and what the causes of the virus are, what symptoms of the virus are, what some treatments are, and what preventative measures can be taken. In recent years, HPV has become the most common sexually transmitted disease in the United States. So what is HPV? HPV is a sexually transmitted disease that is often passed from one person to another during sexual activity. Anthony Angelo, MD, states that at least 50% of sexually active people will contract HPV at some time in their lives. Warren Waltzman, PhD, states that HPV can cause genital warts, precancerous changes in the tissues of the female vagina, and can possibly lead to cervical cancer. What causes usually always comes with symptoms. What are symptoms of HPV? Usually there are no visible symptoms of HPV, but some types of HPV can cause genital warts, states Anthony Angelo, MD. Anthony Angelo, MD, also states that genital warts are a small flesh-colored growths that are usually found in the genital or rectal area and are very similar to common everyday warts. He also states that warts can appear within weeks, months, or even years after you contract the virus from an infected person. Other symptoms of HPV include a bad smell, mild irritation, burning, itching, or pain of the vagina, pain with intercourse, or increased vaginal discharge or bleeding which is caused from the warts themselves. If you believe that you have any of these symptoms, you should consult with your physician immediately. But just because you have some of these symptoms doesn't mean that you have the HPV virus. That's why you should consult with your physician to make sure that there's not other complications. Anthony Angelo, MD, states that there are several ways to treat HPV, which are usually done in a healthcare provider's office. Possible treatments are medicines that are put on the site of the injection, freezing of the warts, laser treatment, LEEP procedure, which is a procedure which burns and removes the infection with a wire loop, and also surgery to cut away any growth or infections. Removal of these warts does not get rid of the virus. You will still have the virus after treatment and could possibly need future treatment, states Anthony Angelo, MD. Overall, the best way to ensure that HPV is not contracted would be to use preventative measures. Preventative measures that people can take to avoid contracting the HPV virus include abstaining from sex altogether, reducing the number of sexually partners that you have, using condoms regularly, and for women there is a vaccine called Gardasil that protects against 4 types of HPV viruses that cause most cervical cancers and genital warts, which is stated by Warren Waltzman, PhD. Gail Slapp, MD, states that things that women could do to help detect HPV is getting routine Pap smears done yearly, or more often if they already have the virus contracted, especially when females are sexually active, since a Pap test is the best way to detect the virus. HPV is becoming more serious of a sexually transmitted disease than it has ever before. I have covered with you what the virus is and what some causes of the virus are, what symptoms of the virus are, what some treatments are, and what preventative measures can be taken to prevent from contracting the HPV virus. Overall, at this time, there is no cure for HPV. So protecting ourselves, especially us women, is in our own hands. Let's take all of the precautions that we can so that we do not contract the virus and stop the spread of the virus before it gets any worse than it already is. This concludes my speech on HPV. Thank you for your time.